maybe like a nursing home, right? And then there comes a patient who is old.
Yeah.
Now as a nurse, what are you going to see till that this patient is having increased pain?
Okay, so as a nurse, if your patient comes in, I'm going to do my assessment on this patient. So what I'm going to look for, let's say for example they're having like a wound in their leg. So to show or to assess that the patient is having increased pain, I'm going to see impaired wound healing. I'm also going to see increased stress response on this patient, as well as seeing they're going to have anxiety, they're going to have fear due to the fact that the wound is not healing upon all the treatment or whatever they have been getting.
Yeah.
Also, we're also going to see
Depression.
depression. They're going to be depressed because they're like, oh my God, what happened if probably they don't treat this wound and doesn't get healed and they end up hurting my legs. You know, they're going to be depressed. They're going to have anxiety. You're going to see increased anxiety. You're going to see fear on their faces, as well as you're going to see impaired. I think impaired mobility.
Yeah,
right?
like they will have the pain, they won't be moving very well.
Yeah, they won't be moving very well.
Yeah.
So we don't want to see that, you know, because we want our patients to have the best rest that they can.
Yeah, I'm not talking on the rest. Also, they're going to be having like impaired sleep. Their sleep is going to be impaired.
Yeah.
And also they're going to be having like reduced immune function.
Yeah.
And at the same time, they're going to have like we talked about like impaired sleep, right?
Yeah, impaired sleep. They're going to have reduced immune function. They're going to have impact on their relationship. They won't be able to interact well with their family members because they don't feel good. They don't feel happy about their situation.
Yeah,
And
I'm
also,
talking about on the impaired relationships. You're going to have like somewhat like occupational challenges. You know, like maybe if they're at work, that they're going to be challenged. And also, even this pain can even prolong itself to be having to tie into chronic pain.
into chronic pain.
Yeah, so that's one. What about if at all the patients are like non-adults? Like, let's talk about the baby or something like, or, you know,
Like they can't
they're
verbalize the
non-verbals, they're
pain. They
non-verbal
can't tell you,
patients.
oh, like for example, mommy, I feel pain here and I feel pain here, right? So now we're going to look at their facial expression of the kids, you know, to see how they're acting. So we're going to see like grimacing. We're going to see like wrinkle face. You know, when you're feeling pain, you're like struggling, and you see their face like the wrinkle in front. You're going to know they're having pain. We're also going to check that like their body movement, how they behave around the house, because I believe as a mom, you know when your child is in a happy mood, and when they're in pain, you're going to see they're going to be like guarding themselves, like pacing, trying to guard that area where they're feeling the pain. You know, they don't want you to touch it and all that. You're going to see like restlessness. They're going to be back and forth in the bed. Even adults, sometimes if you feel pain, not only kids, if you're sleeping and you know you're having severe pain, you'll be like, oh, turning around and all that. So we also see that with
Talking in that, if the children, like babies, they will start like like crying a lot. They're mourning.
Yeah.
You know, they're like, what should I, do they say like they're colicky, something like that? They're like they're
cooling.
they're like they are crying a lot, like they're mourning a lot. You know.
Yeah, and also
What
have
else?
like decreased attention span. You can't tell them to stand here and they stand with that pain, you know, their attention span is going to be decreased because they're having intense pain. So we're going to see all that, yeah.
All right. So another situation, let's say you have a patient who comes in the hospital and then you find out this patient is having high potassium levels in their blood. Of course, we know that the potassium levels in the blood is only like 3.0 to
3.5 to 5.0.
yeah, 3.5 to 5.0. So yes, now you find like the potassium level is about let's say like 7. It's high. What are some of the expected findings, or let's say what are some of the EKG changes you're going to see in this patient?
Okay, so if a patient comes in, they're having high kalemia or high potassium, so we know it's going to cause issues with their heart. We are worried about their heart. First things first, before even going to talk about the EKG findings, we'll make sure we put a patient on a cardiac monitor because we want to check how their heart is functioning. We don't want any issues. You know, they're already having issues, so we want to monitor so we can fix the underlying cause of what is causing them to have that high potassium in their blood, which is causing the cardiac distress. So for the EKG findings, first we're going to see like a peak T wave on that patient. So P wave, like we said, is when there's depolarization in the atrium, right?
Yeah, that means like the arteries are contracting.
Yeah. So we're gonna see peak T wave, which is very high. We also go ahead to see they're gonna have like absent P wave.
Yeah, so basically that means if the P waves are absent, it simply means, can you imagine someone having a heart and their arteries are not contracting? What does that mean? That's a very big problem.
Means the
So
heart is not
in
functioning.
high potassium levels, we are basically having absent P waves, we're having peak T waves, and also we're having other things like
Whiting QRS complex.
What's QRS complex? Basically, that's like the ventricles are contracting.
Contracting,
right?
yeah.
So it means the ventricles are over contracting, like they're contracting and they're not even contracting, like the way they take a lot of time for the ventricles to contract. That's a very big problem.
Big problem.
So you're gonna see where the QRS complex is. You're gonna see like ventricular
Arrhythmias, like
irregular rhythms within the ventricle contraction,
yeah.
right? Yeah. What are some things you may see? What of course, we talked about absent P waves. What about the PR interval?
You're going to see
What's gonna happen?
prolonged PR interval in this patient. So that's when we talk of prolonged PR interval. That's when we, from when the P wave depolarize, that's a contraction of the P wave till the beginning of the ventricles.
Yeah.
Right. So yeah, that's what we're gonna say.
Yeah. And yes. Now we just talked about PR,
Prolonged PR interval.
the potassium, high potassium, and what's we're gonna see. We're gonna see what are some of the general. That was just the EKG. Let's talk about the general assessment findings. What are some of the assessment findings for hyperkalemia in a patient?
Okay, so for assessment findings, like the symptoms, we're going to see if someone comes in with hyperkalemia, which is high potassium in the blood. So we're going to see the patient's going to have like muscle cramps or muscle weakness. They're going to have like urine abnormalities, meaning that their urine is going to be concentrated due to the fact that the body is not taking out the urine caused by, let's say, high potassium, because one of the reasons why we can retain potassium in our body is probably when the kidney is not functioning to excrete the potassium out through urine. So now if we have high potassium, it means the kidney is not functioning, and now we have high urine, everything, our urine is in there conserved in the kidney, everything, so our urine concentration is going to be high. We're going to see that. So we're going to also see
like respiratory distress.
respiratory distress. They're going to have issue with their lungs. They can't breathe very well, and everything is going to happen.
Talk about the heart, so like contractility, like you're gonna have like reduced cardiac contractility, right?
Yeah, so we're gonna see like decreased heart rate and decreased blood pressure. In that patient.
What else do we see?
We will see like ECG changes, like we said, like the T
changes,
wave, the peak T wave, the absent P wave, the Whiting QRS complex, the PR interval, the prolonged PR interval. We're gonna see that. I'm also gonna see like their reflexes is gonna increase. You're gonna have like deep tendon reflexes, which we can be seeing like from +3 and +4, which is abnormal. So for normal it's +2, right?
Thank you all. Thank you for it was a small short break testing ourselves on the different aspects of nursing. Join us later on another break.
Yeah, so when we come back, we're going to be talking about the nursing actions. As a nurse, what do you do for your patients? What advice, like education, what do you tell them in order to help them bring down their potassium level to normal?
All right, thank you.